Now, Dean of the Brown University School of Public Health, Dr. Jha. Doctor, thank you so much for being with us. I'm going to ask you, and I have a personal reason. I'm just going to tell people I have a personal reason for asking this question, because I have a couple of family members that would be very high on the list because of underlying conditions to get these vaccines. And I say, hey, help is right around the corner. And it seems that not only my family members, but everybody I talk to are saying, hey, whoa, wait a second. I'm not going to rush into anything. I don't know if these are going to be safe. Talk about how much of a problem that's going to be, convincing Americans that these coronavirus vaccines are going to be safe, and how we get that message across to them.
Yeah. So good morning, Joe, and thanks for having me on. So about 60% of Americans are ready to take the vaccine. Well, that's the good news. Of course, the bad news is about 40% of people are feeling pretty skeptical. And I think I understand the skepticism. The skepticism is, we've developed a vaccine very quickly. People want to know about the long-term effects. They want to know if it's really safe. And my short answers are, first of all, the science behind the vaccine development has been really extraordinary. It's been done with full integrity. There have been no corners that have been cut. We've just gone much, much faster than we normally do, obviously because we're in a crisis. And so everything I have seen makes me feel very comfortable that it's safe. I will be delighted to get vaccinated when it's my turn to do so. I think we just need to do is communicate openly and honestly with the American people about what we do and don't know. Don't oversell it, but be very clear that the science so far has been terrific and no corners have been cut.
So a couple of months ago, I was hearing from people inside the administration, the Trump administration, and outside of the administration that, hey, maybe we'd get this thing in October, but there'd probably be about a 50% effective rate, that the rate would be like most flu shots. And then suddenly, a few weeks ago, we start hearing about 90, 94, 95% effectiveness. Explain how a vaccine could be that effective.
Yeah, so we do have vaccines that are that effective. The measles vaccine is about 98% effective. I was one of those people who thought 50, 60% would be terrific. I barely could hope for 70 or 80. Again, this has been done very well, and sometimes you also get a little bit lucky. Like we have the target of the vaccine, the spike protein of the virus, turns out to be a really good target. And we didn't know that it would be as effective as it is. So I just take that as 2020 has not been a year where we've gotten lucky on a lot of things. This is one where the vaccine has turned out better than I was expecting.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.